Medicine is not about the knowledge, the book knowledge you learn. A good doctor is the one who humbles down to explain to you, this is what I'm going to do. Excuse me, my name is doctor. You know the basic etiquette that we are taught in clerkship? That is where a good doctor is drawn. Inspire people to want to do good. When you inspire them, human beings always want to see what is in it for me. So you need to give them the dream of the vision so that they own that vision. Only when they own that vision will they also want to achieve your vision. A hospital is the only person with no rights. Today a patient will come here and tell us, please doc, just help us. Oh, don't worry, we have money, we do what. You come take them because you have a heart and everything. You put them to the ICU, you start treating them. When this patient wakes up and starts walking, you will see a different side of these people. I tell people, a patient is not your relative or a friend.
Welcome to Daktari, where voices, perspectives, and sounds relating to healthcare practitioners and matters health are amplified. This is a podcast by Daktari Online, created for healthcare professionals across Kenya. Each episode brings you honest conversations, expert insights, and real-life stories from the front lines of care. Welcome back to another episode of Daktari podcast. With me, I'm still with Dr. Maxwell Okoth, and in this session, we're going to talk about leadership, lessons learned, and the future. So, Daktari, my first question to you is, what leadership principles guide your decision making?
I think first and foremost is you need to be a listening person. Listen more, because sometimes when you're a leader and you've always been used to leading, you think your view is the only view. So it's always good to get different perspectives from different people. And I tend to also give people the chance to do what they need to do best without being there, behind their back. People perform better, of course, not everyone, but it makes people to be more innovative when you give them that freedom and space to operate. But you need to be firm. People need to know there's a line. If you cross, there are consequences.
There's a boundary.
There's a boundary. So be a listening person, be understanding, very understanding. But then again, also, I keep saying, and forgive me, I say sometimes human beings are like goats. If you leave them in a grazing field, they will all be all over. So they also need to be channeled sometimes on how things should be done.
Okay, so listening, understanding, and be
firm and knowing and draw your boundaries.
Okay. Could you share a moment when your leadership was tested?
A million times.
One that stands
I say leaders will always be misunderstood. And when you're misunderstood and a leader, don't worry, don't sweat, don't kill yourself. The results should always speak for you. For example, I'll give an example of this country. I will say Kenyans would not have praised Kibaki when he was on the seat than they're praising him today. You understand?
Yeah.
So as a leader, you need to be guided by the results you hope to achieve. So when my leadership was tested, I think leadership is tested every day. You get people just not wanting to do what they're meant to do. People want you to keep supervising them. People want the easy way out of life without knowing their obligations. Life would be much easier if everybody was doing what they expected to do. So your leadership will be tested every day. Your patience will be pushed every day. But you just need to stick to what I've said. I am understanding. I am listening. But I'm also not taking nonsense. So when you know those three things, then we will work. Yes.
And we'll bring up more
services. We will be productive.
Yes. Okay. And now, from one facility to more facilities, you mentioned 11.
Yes.
So how do you inspire and motivate teams across these facilities?
There are different types of leaders. There's the charismatic leader, there's a transformational leader. There's all the different types of leadership. I always say, be a transformational, charismatic leader. Inspire people to want to do good. When you inspire them, Human beings always want to see what is in it for me. So you need to give them the dream of the vision so that they own that vision. Only when they own that vision will they also want to achieve your vision. So you need to be that leader that motivates and aspires people's ambitions for betterment. With that, you don't need to keep guiding them. So if I tell you, you don't see RFH where it's going, but me, I see it. Yeah. I paint for you that vision of where RFH is. When you buy that vision, like the person I told you we started with, he bought that vision. It becomes easy. So anajituma yeye mwenyewe. I don't need to be there because he knows Doc amesema huko ndio kwenye tunaenda. Mimi naenda, he says Kenyan say tunaenda Canaan. So uwauzie hiyo Canaan. Unaona? Wakishaona Canaan kwa macho, they will work towards that Canaan.
So what I'm getting for you, how you work as a leader first, is you have to be goal-oriented. Have the goals lined out. Yes, of course, you'll get backlash. There's those who will still praise you. There's those who will still be just, neutral to your leadership. But then when you have goals, you have your roles there, your goals are present to you. You are aware, you're sure that, of course, it's not going just to be easy to reach it. So you work towards that goal despite what you have.
And I aspire my team to know where we are going. So when they buy that dream, it becomes very easy to lead them. I don't need to be there.
Okay. Yeah, great. So now, coming into now the healthcare in Kenya, the present and the future, I believe you already mentioned it in our prior episodes, but then just because at this moment I still need it to come out now as it's a standalone, where do you see the state of healthcare in Kenya?
Healthcare in Kenya is transforming at a very rapid rate. Kenya has been earmarked as the hub of healthcare in East and Central Africa. We are going to see a lot of mergers and acquisitions. We are going to see a lot of big players coming into the market. You're going to see multiple international players coming in. A lot of hospitals are going to be bought out. Small people will just naturally fizzle out. So you either be big, you either get big or go home. That's what is going to happen. There's going to be a lot of investments in healthcare, but I'm afraid this might also push the cost of healthcare higher. I foresee insurance coming to also own the value chain, where insurance companies might start also owning hospital chains so that they also control the costs, because their costs are insane. But there needs to be a lot of honesty and genuineness as a country on who takes care of the social aspect of health, who takes care of how we control the costs and inputs of health. Only when we do that are we going to achieve some of these things. Otherwise, we are going to create a country that has very different, significant inequalities, where only the rich might be able to access health and the poor might not. There are efforts to bring in universal healthcare. We might get there, but we'll have to go through a lot of challenges to get to that point. But we will also need to be honest and listening to the people for us to get there.
And if you could change 3 things in policy or investments tomorrow, what would it be?
Change 3 things in policy, investments in health. I would want there to be equity in how we regulate both public, private, faith-based, number 1. The same standards to be held across all those different categories of owners.
Why so?
I feel like there's a difference in standards when it comes to private versus when it comes to public. I see there's an effort. Now we are saying in public you cannot share beds. We are heading somewhere. There should be same standards of measure in terms of quality of health and service delivery. So the same yardsticks should be used uniformly across board. That will ensure quality of healthcare is offered across, regardless. And that's when public sector will also rise. When a public sector is strong, the private sector gets even stronger. These countries we go to does not mean they don't have public sector, but people go to private, but their public sectors are also very functional. The other thing I would change is I would wish that the government is left for policy and regulation. People will disagree with this because they think it will increase the cost of healthcare. But if government is in policy and regulation, even on the cost, then the private sector does what they do best, which is operationalize. then Kenyans will get the exact quality they need.
Okay, so now, great. So for this next segment, I'm going to touch on you now, talking to the young medics, entrepreneurs, health leaders. And at the beginning, I did ask you a question where we touched on mentorship, and you said you wished that you had started earlier, but you still later got to be mentored. So currently, there's, I believe, 2 or 3 types of mentorship. One which you drive them to you, and those that who now find you. So at this moment, are you mentoring any young entrepreneurs, young health? How is that like?
I am part of the Aspire Mentorship Program by Stanford Seed. So I have a mentor that I mentor based in Ghana. There's a young doctor that I've currently taken that I'm mentor. I think you have seen him around, that I took just after I graduated. Very helpful young man. I see a very bright future for him. But also, again, your table sometimes is full. There's only so much you can take. Yeah. I hope that at some point, based on the life lessons I've gone through, the missteps I've done, the strengths I've seen, the achievements I've gotten, I would probably one day start a program that can do this in mass as opposed to individually. It gets more reach and more impact as opposed to this. Because otherwise this remains an issue of privilege. Do you have access to him or do you have access to someone?
Mm-hmm. Okay. So in this instance, I would like you to imagine that now you're mentoring, a young health professional. What are those 3 things that you would tell them?
In healthcare, it's your attitude more than anything else. Healthcare today is flooded, as they say. We don't have the numbers of doctors we need, but we have doctors who are not getting work. Yeah. So you have to be very good. So there are basic things you need to learn.
Sorry, let me cut you short. What is very good?
This is what I'm saying. Okay. You're very good is healthcare. People need empathy. How do you explain? It's a small life skills that even med school does not teach you. Medicine is not about the knowledge, the book knowledge you learn. A good doctor is the one who humbles down to explain to you, this is what I'm going to do. Excuse me, my name is doctor. You know the basic etiquette that we were taught in clerkship. That is where a good doctor is drawn. Not the big ones. The doctor who understands that by the time I'm done with your history taking, I have 70% of your diagnosis.
Actually, that reminds me with one interaction I had, and I picked it up. The doctor said, I am not treating the disease, I am treating the human.
The person, yes. So you need to be very keen. There are small things we were taught that nowadays I see the doctors coming in not having, and I don't know what we missed or where we lost it, but I'd tell them to also kujituma. Medicine is an apprenticeship. Yeah. And now with many numbers graduating, if you're not aggressive to go out of your way, you will not learn anything. We have interns graduating after internship without even knowing how to do a cesarean section.
That still reminds me of your case, for example, where now your dad, who influenced even you to take the path, did consider you being a medic because of the not it having many numbers or even it being a guarantee that you would be employed. Of which still, it's the same case at this era, where you'd find, because you've mentioned a very great thing, attitude and now being a doctor, where you might find maybe people are coming into this space because they think, it's fast money, it's quick money, or, maybe I do not even have a passion for it or the attitude and altitude for it. And I'm just going because I want to get quick money. I see Dr. Maxwell there with RFH, many buildings. I'm like, I just want to be like him. And what would you say about that kind of line of thinking?
There's nowhere there's quick money in this world. Okay. The fastest you get it, the fastest you lose it. Yeah. Okay. There's no shortcut. So I think the few times I tried to ever take a shortcut in life, I was hit very hard. And I've always learned there's no shortcut in life. You will never get a shortcut in life. If you see it too fast, it will come down too fast. It's the same way it did.
And with that, how do you think healthcare professionals can balance between compassion with financial sustainability? Because at this case, it's still a conversation you still need to have.
Money follows good things. When you do right, it comes to you. If today I treat you very well, you will go and say, there's a very good doctor in this place. Even if I charged you 50 bob, tomorrow you'll bring 10 more with 50. But the one who comes and says, me, I want to make money, and I charge you 1,000 and I treat you trash, tomorrow I will not have a patient. That's why you find some people are surviving and sustaining themselves, regardless of how much you try to spoil their reputation. You understand?
Yes, I do.
Because they are basic ethos and principles of life that they hold dear to themselves.
What are the biggest misconceptions about starting a healthcare venture in Kenya?
It's profitable, that's a lie. It's easy, that's a lie. I see people opening hospitals and I laugh. It is the worst thing you'll ever want to do.
But of course, again, I do believe that many have opened and have failed. But also, again, many have also started and
You might think they're successful, they're not successful. A hospital is the only person with no rights. Today, a patient will come here and tell us, please, doc, just help us. Oh, don't worry, we have money, we do what. You can't take them because you have a heart and everything. You put them to the ICU, start treating them. When this patient wakes up and starts walking, you will see a different side of these people. I tell people, a patient is not your relative or a friend. He is a patient. The moment they are okay, you see a different side. I say, oh, you know what? Oh, you are overcharging, you're expensive. Oh, they put you on social media because your hands are tied. You can't tell the world what you're dealing with. So there's always a one-sided story that will go there. Oh, these people are just after money, or they forget how they walked in. And there are many of those cases. Kenyans will pay faster in a garage than they'll pay in a hospital because they think healthcare should be free. But there are costs to healthcare. So it is not one of those jobs you'd want. You have no right. You will be stepped on. You understand? The payers who pay you will pay you when they feel like, but the people who you need to pay will always want to be paid immediately. So you are always a slave of everyone you interact with in your stakeholder cycle. So that's what healthcare running is. Very few people will run a hospital and walk out okay. Yes, that thing can make you insane.
Now let's talk about work-life balance. So how do you balance both work and life?
At some point I was not balancing. I almost lost it. Battled anxiety, a bit of depression here and there. I have learned, nowadays I do a lot of working out. I release my energy there. I do a lot of traveling. So we do a road trip sometimes. I started this farming business that is like a hobby, just to calm me down. So going to see goats and just grazing them over the weekend. So that's where I find my sanity.
Okay, and what do you do for fun?
What do I do for fun nowadays? I just traveling. I used to party a lot. I think I've done the whole battle of it. It's not a cycle. It's not a cycle I want to go back to. Yes, it has its all disadvantages, but yeah.
A good question I love asking almost all doctors is, do you feel you spend enough time with your family?
I never used to. Yes. I am nowadays. I am intentional about it. Yeah.
Oh, great! The word intentional.
Yes, it's being intentional about it. Yes. So yeah.
Okay. So for that segment, we're done. So we're going to have quick fire fun questions. Again, we'll do it as we did before. So I'll ask you a question. You ask me a question. So, what is the best career advice you've ever received?
Best career advice I've ever received. What's the best career advice I've ever received?
Yes.
Do good and shame the devil.
Oh, okay. Okay. But I don't even have a further question for that one. Okay, ask me a question.
What's the best career advice you've ever received?
No, don't do that.
No, I mean, come on. It's a question.
But for the next one, don't do that.
No, yeah.
Okay, so the best career advice I've ever received is find your purpose. Because, when you do that, you'll be driven. It will even drive you. I remember there was this time when I was so in need of getting a place to do something. I was even so willing to even do volunteer. And when I was doing it, money even didn't come fast. I just needed a place to go and be busy. I just needed to be a place, and just not busy. You can be busy and be a busybody. But I was, I'm giving back. I'm doing something. And that's why I was like, that drive, and through it, I'm not sure if I've already found my purpose, but I feel within it, I'm still exposed to so many things. I meet very many people, different people, and within it, maybe it will just come to me. And yes, be driven by purpose.
Amen.
Okay.
Mhm.
So, what is that mistake that became a turning point for you?
Oh, my mistake that became a turning point for me is I think I prioritized work too much that I forgot my family.
Okay.
And at some point, I almost lost my family. And that became my turning point. It was a wake-up call for me.
Yes.
Yes. We chase all the things out there, and you forget the core things that matter. Yes.
And that's why one thing I'm getting is growth, and the fact that you are willing to, be aware of it and take charge.
Self-awareness is everything. You always need to call yourself for a meeting. When you're saying kujiita mkutano. Yes, it's a very important.
One thing I'm also getting is that you can still unlearn and relearn and keep learning how to do right. You'll never get perfect, but you will get to.
No one is perfect. And if you're perfect, then there's a problem.
Okay.
Your imperfections bring out your perfection.
Okay. A question for me.
If you were to go back to your high school, what would you change?
Okay. So that's a very good question, actually. So for the better part of my high school life, I was a leader as well. I joined Form 1, I became the class rep. Form 2, I became, I think, a dorm prefect. I can't remember, or sanitation. About Form 3, the assistant head girl. But Form 4, I was like, nope, I'm not going to take leadership, because it was a whole, I felt like it was a whole burden. Not the fact that it would affect my studies, not really, but then there was a problem with the fact that I didn't go for the position for the head girl. And I met the deputy then was a new deputy head teacher. So she was like, why are you not vying for the position of the head girl? And I was like, okay. I was also on and off for some time in school because of school fees and all that. So I felt like the head girl needs to be present in school. You need to present people, and you can't do that when you're home sometimes. So I remember she told me something, and I'm still not answering your question, but I'll get there. She told me something. I was like, okay, fine, I can take the dormitory prefect. And she said, you can never go from a higher position and then choose a lower position. You better be nothing.
Nothing, yeah.
Do you know, I ended up not being the head girl, of course, because I didn't want to change my mind. But I also never, because if you're not a head girl or a prefect or in that area, you have to work or do some cleaning. I never did none of that. I was just there, attending classes and doing all that. So one thing I would change is the fact that, I think it's cutting across schools, because it literally affected not only me and more other students. Not that you have to be home every time just because a parent couldn't pay school fees. Anyway, I know, yes, some it's negligence, but then if there could be a place where we have a limit that maybe you could not do this until you finish this amount or that, but keeping me out of school, it affected even my French classes. Yeah, because French and all new languages, you have to. I was really passionate for French, but then I couldn't. So I would change that. I would change the fact that some people have to be home just because they're not able to pay school fees. Yeah.
Oh, okay. Great.
Yes. So what is that one book or resource every young leader should read?
I have 3 books that have changed my life sequentially. Rich Dad, Poor Dad moved me from where I started and said I wanted to be there. Gave me the life basic lessons. The Alchemist was the next book that really turned how I think about life. Then The Monk Who Sold His Ferrari was the other one. Yeah, just finding your inner peace. And then Who Moved My Cheese?
Okay. This is interesting. Now, I'm having an additional question. What are your hobbies? I know you asked what you do for fun, but then because you've mentioned 3 books, that means you read. You read a ship.
No, not so much. Not so much. But if I get an intriguing book, I'll finish it. Yes, you really need to captivate me. If by the 10th page I'm bored, I'm done with that book. Yes, but if I hold it and I'm on the 20th, 30th page, I'm finishing that book. I don't read as much. I try to read. What are my hobbies? I think think business made me lose who I was.
Uh-huh.
I'm trying to refine myself.
Okay.
Yes. Yeah.
It's doable. And yes, we build different personalities dependent of our environment. So I know you will get there.
Yes.
Starting with the swimming classes.
Yes, exactly.
Okay, so now beyond papers, what do you look for when hiring?
Attitude. It's not even papers. I look for
But then
attitude.
how would you, okay, let's say I came to your office right now, how would you know?
I don't know. I'm a judge of character.
Ah.
If you walk in, I'll probably have a perception.
But remember sometimes, okay. Also,
Yes, I could be wrong,
No.
but more often than not, I don't know. It has always worked.
Those are many years
I would walk in and just how you talk, and by that time I'll have known. Yes, that the instances have been wrong.
Okay, a question for me.
Which is your best book?
My best book. I'm more of a fictional reader. So I'm trying to think there isn't one that I'm reading right now. Christ. Okay, it's on my desk, but I can't. I'm trying to remember that. I'm only seeing the right first name.
They'll tell me when you remember.
Yes.
Okay.
So, okay. A myth about career or leadership that needs to die.
A myth about career and leadership that needs to die. Career is people think that the top 5 courses is what makes you who you are. A lot has changed, to be honest with you. Yeah. If you're looking for money or whatever, it's not what people used to think. Today, if I was advise a young person, I'd tell them a lot of different things. The world has changed and it's upside down. So do you what moves you. It starts with passion first. Whatever you are passionate about. As a typical cliche, they say, sweep the streets like no one else will ever, Yes.
Okay, a question for me.
What do you see as success?
What I see as success? That's a good question, actually. Well, the word failure is in my head. Of course, you're going to try so many times and fail. But the fact that you tried, as much as maybe the end game is not what you expected, that to me is already success. Because you see that mindset of, let me do this. I want to venture in this. That is already a successful mind, rather than a mind who's like, what ifs? With very many what ifs, you haven't tried, you've not taken the risk. Yeah, it has happened to me so many times. I might get into an office. In fact, when you're talking about other than just hiring papers and all that, it reminded me of times when I would enter an office. Of course, I'm sure you've been on the hiring tables. The way we get in there, we're scared, we're all uptight and everything. And so I've tended to ease up. And I also realized that this is just, even talking to you, it makes me realize that you people are also once young. Of course, there's a place.
What do you mean? Am I old?
No, you're not old, but you're young in a space where you were once like me.
I am still young.
Yes.
Amen.
Okay, let me rephrase that. You were once in that position where I am in.
Okay. No, it's okay.
Yes, you walked in a space where you also needed maybe to be hired, or someone to listen to you, or someone to give you a chance. And of course, when we see us there fumbling and fidgeting and everything, it reminds you of all that. And so for me, success is the urge for you to just try, do it, fail it, make it, do it again, try something else until you reach it, you get there. And even within those trials and errors, you even get to even establish more strong goals and look forward to them.
Great.
Okay, so this question you already answered, because I think I already have an answer to this, but let me just ask it away because it's my last question, is if medicine was not an option, what career would you choose?
I told you. Yes. I would be dealing, I would be trading, whatever it is.
Yes. So, do you have another question for me?
No, I think, yeah. we cannot finish. I have many questions.
Okay, you can ask one more.
Me?
Yes, you can ask me one more question.
Do I have a question? What's your perception of doctors?
Hey, that has changed over time. with the knowledge I have now, hey, if you phoned me 5 years ago and asked me, what? But then I think that also happens just across even my age. So at first, I'll give you my first perception about doctors. I just used to think doctors are demigods.
Oh.
I didn't know there was specialization. That I didn't know that. Oh, when I enter an office or a hospital, I expect that doctor to be able to treat everything. I didn't know that I have to be taken to a gynecologist for this, or a cardiologist for this, or a gastroenterologist for this. I didn't know that. I usually just knew general practitioner is an answer to everything. Of course, I had the negative side because I've seen the public hospitals, having less numbers, and then you'll blame a nurse, you blame a doctor, how he handled maybe a patient. But then from the other side of it, I get to understand. The ratio of 1 to 1 is not easy. Or a ratio to one doctor to 3 is not. It's even in Kenya, we're still not going to achieve that anytime soon. Yes, doctors may be at home and all that, but then the pressure behind that doctor, you might find that doctor treating 2 more patients or 3 in that timeline. So you have to be in some type of way. Yes, of course, he's compassionate, but then you cannot also just be slower because he also wants to save your life.
Okay.
Yes.
Great.
So you're going to give us your parting shot. If you feel I've left anything out, say it all.
What's my parting shot? I don't know who the audience are, but I want to assume most of them are doctors.
Yes.
The industry is changing, and I think the industry needs to be more than ever united. We are going to, if we are not careful, then this industry is not going to be run by us anymore. We are going to lead it for businessmen. And until we're intentional to support doctor-driven enterprises, then we might lose it. And my urge is, as a doctor fraternity, we need to hold each other's hands, the spirit of Ubuntu, and just come together and support one another and bring back this profession where it belongs. Otherwise, we'll have lost it. That would be my parting shot. That's it and done. Thank you very much.
Thank you too.
Thank you for having me.
That was Dr. Okoth, and we thank him for not only sharing his professional journey, but the heart of it, from his humble beginnings to RFH's impact to the undeserving communities. For our listeners, I hope this episode sparks new ideas, innovations, and the future for tomorrow. To get more episodes like this, follow our social media platforms at Daktari Online. See you next.